Today I will be speaking upon the common myths and misinterpretations in cancer. There are few myths in cancer, one of which is cancer means death sentence. Is it true? No, it is not true, because few cancers like prostate, thyroid and breast, the survival rate is 90%, and all the cancers put together survival rate is 67%. So cancer is not a death sentence, and there are cures which are available. Secondly, cancer runs in a family. If a family member is affected with cancer, the remaining people also are affected with cancer. Is it so? It is not so. There is only 5 to 10% chance you may get the cancer if your family member is affected with cancer. 90 to 95% of the time you are free from cancer. And if your family member is not having cancer, is there a risk that you are not having cancer? It is not so, because you are exposed to other environmental risk factors and you are at risk of developing cancer. Obvious. Cancer is contagious. Is it true that cancer spreads from person to person? Definitely not. It is not contagious. But infections are contagious. Suppose a person has an HPV infection, it is contagious. And if a patient with cancer donates an organ for organ transplantation, again there is a chance that the person who receives the recipient is at risk of getting cancer, but that is also around 1% only. Other thing is hair dyes and deodorants. Do they cause cancer? No. Hair dyes and deodorants, they do not cause cancer. It has been proven beyond doubt. But there is a risk that if hair dyes are used for a long period of time and heavy amount of dosage is used, there is a minor risk of bladder cancer. And about cell phone usages, will they cause cancer? Usage of cell phone, usage of power cables, radiation hazard, will it cause cancer? No. Extensive study has been done, and most of these radiations are only low frequency radiations, and they do not cause any cancer so far. And also one more myth is sweets are artificial sweetness. If a person who is taking more sweets or a person who is diabetic is more prone to cancer, because there is a myth that cancer cells survive on sugar. It is not so. It has been proven beyond doubt that sugar levels are not related to cancer, and stopping the sugar levels or controlling the sugar levels does not cure your cancer. So doing a surgery or a biopsy will only spreads the cancer. Is it true? It is not true. Either a biopsy or only surgery, or a surgery will only help in treating the cancer early, and it does not spread the cancer. It is proven beyond doubt. Herbal medications and Ayurvedic medications, will they help in the cancer patients? There is no scientific data to say that herbal medications or Ayurvedic medications are helpful, but there is data to few of them are harmful if they are used in combination with chemotherapy or radiotherapy. And last thing is attitude. Few people believe patients or cancer patients with positive attitude live longer than cancer patients with negative attitude. Is it true? It is not true. Scientifically, this is not true. Though it is good to have a positive attitude, there is no difference. This attitudinal difference does not have a bearing on the lifespan of the cancer patients.